The infection called hand-foot-mouth or HFMD is a viral disease typically occurs during the summer or early autumn and mainly affects children under 5 years, but it can affect adults too. There are many outbreaks that have been reported in different places such as schools, summer camps, hospitals, and military installations. The disease is characterized by an oral enanthem and a macular and vesicular rash of hands and feet. Multiple viruses can cause hand-foot-mouth disease. The majority of these viruses belong to the enterovirus genus. Coccivirus A16 and enterovirus A71 are the most common cause of HFMD and responsible for the majority of large outbreaks. This disease occurs after oral ingestion of virus into the gastrointestinal or respiratory system. Enterovirus can also spread by oral and respiratory secretions. Virus may be detected in the stool after a long time for about 6 weeks and more. That is why the virus is transmitted from person to person by the fecal-oral route. The incubation period for HFMD averagely is 3 to 6 days. HFMD may cause some of the following symptoms: mouth and throat lesions and pain, fever that is generally below 68.3 degrees Celsius, rash on the palms, soles, around the mouth, and sometimes buttocks. The rash is not itchy, and depending on the skin color, it can appear red, gray, white, or only shows as tiny bumps. The cardinal phenomena of HFMD are the oral exanthem or enanthem, but sometimes just one of them may appear. The exanthem related with HFMD can be macular, maculopapular, or sometimes vesicular. Other less common symptoms are fussiness, abdominal pain, and loss of appetite. The most common complication of HFMD is decreased oral intake, which can result in dehydration. Barely it may result to some serious complications such as meningitis, encephalitis, acute flaccid paralysis, myocarditis, or onychomatosis, means shedding of the nail. That is a late complication occurs 3 to 8 weeks after disease onset. Laboratory studies usually are not specific in children with HFMD, but sometimes it can be associated with hyperglycemia and increased neutrophil count. Management in HFMD is generally supportive. Patients with complications require hospitalization. Unfortunately, there is no effective antiviral for HFMD. The medications are mainly used to manage fever and pain. Acetaminophen and ibuprofen can help relieve discomfort well. But it is necessary to know this medication should be avoided in children with dehydration. So in dehydration, the first step is to volume correction. Children who can drink sufficiently should be hospitalized for parenteral fluid therapy. We don't routinely use oral topical therapies containing lidocaine because they are not approved yet to be safe. It is important to know the factors that can be used for prevent this disease. The first and important preventive factor is hygiene, especially hand hygiene. Surfaces that are contaminated with secretions or feces should be cleaned and disinfected. Isolation for hospitalized patients should be done for the duration of the illness. And finally, vaccination for prevention of enterovirus and paracovirus can be useful.